a quick activity to kind of get us all oriented to what we're going to be talking about today. I'll be asking all of you to put an emoji either through the chat, or if you feel comfortable using the emoji, I think it's it's attached to Zoom. If you go to the bottom of your screen, you can actually, it's called reactions, which is also an emoji. Just that represents how you feel about data. So as Jamie said, one of our objectives of this meeting is to help programs feel more comfortable with evaluation and with reporting outcome data. So on first glance, how do you feel about data? Are you excited? Are you happy, confident, nervous, overwhelmed? And all emojis are accepted because data is exciting, but can be overwhelming, and we acknowledge that. I see some smiley faces. I see some overwhelmed faces. Yeah. These are good. Yep. David, that's a good one. That's a good one. Yeah, it's kind of like, it is what it is.
It's kind of like, eh.
Yeah. Awesome.
Great. Thank you so much. So that gives us just like a little bit of a pulse check. It looks like some people maybe are excited and confident. Other people are indifferent. Other people, I think we saw some screams, some frowns. So, you know, all of those emotions are definitely totally acceptable and understandable. And I think that just kind of helps us understand where everybody is coming from. So hopefully we can make it feel like a little bit less scary today. Okay, so again, we're going to kind of start this meeting with an MHSA program reporting requirements overview. Again, I know for a lot of you, this will probably be familiar. You've probably heard this a million times, but just so we're all kind of on the same page. And also just so this can serve as a resource. I'm sorry, I forgot to do it, but I think either Patty or Paulina started the recording. So just so you know, this meeting is being recorded, and we will share the PowerPoint as well as the recording afterwards. So this can also kind of serve as a reference for everybody. And we just wanted to kind of get all the information in one space. So like we said, like the reason that we're here really is because we updated the MHSA reporting process a couple of years ago. Some of you may have been a part of that or remember. And we've kind of used this new reporting process for the past two annual update cycles. So prior to 2021, some of you may have remembered there was like a Survey Monkey, and you put all of your information into the Survey Monkey. And we changed up the process last year or a couple of years ago, to actually build out these Google Forms to make them a little bit easier to use for all the narrative information. So we've been using those for the past couple of years. But I think we've gotten some feedback through those years that maybe some of the questions were a little bit confusing. You didn't really understand what you were supposed to be putting in. I think especially around kind of this outcomes section that PEI programs were required to report on was really challenging for folks. They didn't really understand what was supposed to be in it. So that's one thing. We really want to try and make these forms a little bit easier to use. The other thing is just over the past couple of years, our understanding of the MHSA reporting requirements have evolved and kind of gotten more refined, and we have a better understanding of what they're looking for and asking for. So we've also made some changes to kind of better align with that. And then the last thing is that across all programs, we were asking for outcomes and impacts, but kind of in a different way. For CSS programs, it was a little broader. It wasn't as specific of what we were asking for. For the PEI programs, I think it was really confusing and daunting. So two things, like one is that we're actually asking all programs to be reporting on outcomes now. And hopefully the way that we're asking for those outcomes is a little bit clearer and a little bit aligns better with your actual program goals. Scott, is there anything that you wanted to add here?
No, I think you got it covered.
Okay. So briefly, so since MHSA was implemented in 2004, there's kind of always been this annual update process where every year, every MHSA program is asked to provide some information about the previous fiscal year. So what the program status is, who was served, and kind of program accomplishments, as well as challenges, and then any changes for the upcoming fiscal year. So that's been pretty standard for all MHSA programs. But in fiscal year 18-19, the MHS OAC, the Mental Health Services Oversight and Accountability Commission, added in additional reporting requirements for the prevention and early intervention, or PEI programs. And part of the reason that they did this is that they really wanted to understand the impacts of these prevention programs and also kind of understand what might be effective both locally, but also see if there's any strategies or programs that could potentially be learned from and kind of implemented across the state. So as part of these kind of updated reporting requirements, there's still an annual report. We call it the PEI annual report, but it's basically the annual update that all programs have been doing since MHSA was implemented. But there's some additional information that PEI programs are required to report on based on their specific PEI service area. The bigger shift is that there's also a 3-year evaluation report that's not just asking for the program status, consumer served, accomplishments and challenges over the previous 3 fiscal years, but also asking about outcomes achieved during that time period. So we actually, with Lake, we put together a 3-year evaluation report in this past year's annual update. So there won't be another 3-year report until 2025. But in order to have a 3-year report reporting on outcomes, we really need to be collecting and reporting on outcomes on an annual basis. So just so folks know, you probably know what, within MHSA, there's the CSS programs and the PEI programs. You probably already know which category you fall into, but just wanted to kind of list them out here. There's also a few programs that kind of span both that have blended funding. So the outreach and engagement and street outreach and the peer support recovery centers use funding from both the CSS pot of MHSA as well as the PEI pot of MHSA. For the purposes of annual reporting and kind of just for this training moving forward, we're asking those programs to report on PEI since the PEI programs reporting requirements are a little bit more stringent. So just generally, like we kind of already went over this, but the things that all programs are required to report on an annual basis is the program description, how programs are reaching underserved populations, the number of folks that they're serving, as well as demographic information, program activities, including successes and challenges over the previous year, as well as anticipated activities and changes for the upcoming year, and then also some things related to budget, like how much was spent and the budget for the upcoming year. The PEI programs do have some additional reporting requirements. So some of the things are this adherence to the MHSA general standards. There's also some additional description of the target population and program methods depending on the PEI service area. all PEI programs are also intended to implement these 3 PEI strategy areas. And those strategy areas are increasing access and linkage to mental health treatment, like clinical services for folks with identified serious mental illness, improving timely access to any mental health services for underserved populations. The difference between this and the first one is that it doesn't necessarily have to be clinical treatment and the folks don't necessarily have to have identified mental illness. And then all PEI programs should also be implementing strategies to reduce stigma and discrimination of mental illness. So then PEI programs, like we said, also have to report on outcomes on kind of an annual and 3-year basis. And those outcomes also differ by the PEI service area, but generally they should either be PEI programs should be showing a decrease in mental health symptoms or improved recovery, a reduction in risk factors or an increase in protective factors against mental illness, a decrease in other types of negative outcomes. This might be hospitalization, incarceration, or homelessness, and then any other program outcomes that are kind of relevant to your program goals. And just as a reminder, so these are the different PEI service areas. There's prevention, early intervention, access and linkage to treatment, improving timely access to services for underserved population, outreach for increasing recognition of early signs of mental illness, stigma and discrimination reduction, and suicide prevention. It's a little confusing that 3 of the service areas are also strategy areas. but try not to get too caught up in that. Just wanted to kind of call out that that is something that's a little bit confusing. And then this is just the programs that kind of fall into each service area. If you don't know what service area that you're in, that's totally fine. We've actually developed your program reporting forms to kind of account for the service area that you're in. But early intervention services are part of the early intervention service area. Mental health first aid is the program in the outreach for increasing recognition of early signs of mental illness. Motherwise is a prevention program, so is the NEST. Older adult outreach and prevention fall into this improving timely access to services for underserved population. The peer support centers are actually an integrated program where they span multiple service areas, including prevention, stigma and discrimination reduction, improving timely access to services, and access and linkage to treatment. The prevention mini grants are part of the prevention service area. And then the statewide, regional, and local projects, this is like the suicide hotline or the crisis hotline, QPR, those are part of stigma and discrimination reduction and suicide prevention. And then lastly, the outreach and engagement and street outreach are part of the access and linkage to treatment. So I know this slide is really tiny and has a lot of information in it, so I won't go through every single one. This is really here more for just kind of, if you want to come back and reference this, we'll also be developing like a handout for you. But we just wanted to put kind of each service area with a specific kind of additional reporting requirements that are expected from PEI. So and like we said, like we've already developed the forms with these differences in mind. So you don't really need to know these. We're just kind of letting you know. But so for example, prevention, this is the Motherwise program, the NEST, as well as the prevention mini grants. So some of the additional information that's asked of prevention these prevention programs is just a description of the target population, which all programs have to do, but then asking specifically about what risk factors make this population a greater risk of developing mental illness, a little bit of description of how the program will address these risk factors or strengthen protective factors that might lead to improve mental health, emotional, relational functioning, and kind of mental health recovery. And then some of the outcomes that should be reported for these types of programs is something like showing a reduction in these risk factors that the program is aiming to alter, or an increase in protective factors. Whereas, for example, the outreach for increasing recognition of early signs of mental illness and the mental health first aid program, they're also required to kind of talk about the methods that are used to reach out and engage potential responders, and how the training is going to teach these potential responders how to identify and respond to signs and symptoms of mental illness, and then the settings in which these trainings are conducted. So we know there's a lot of information on here. We'll go through it kind of in more detail, and if any program has specific questions about what you're required to report on, we can definitely kind of address those at a later time through email, or even setting up kind of one-on-one time. Okay, so briefly, like we said, the changes that we've already made to kind of improve this process was moving away from SurveyMonkey, where all the programs used to kind of include all the information for the annual update. And instead we created these Google forms to help track the more narrative information, like the program descriptions, activities, and outcomes. And what we're doing for this year is updating those Google forms further to include some of these additional reporting requirements and descriptive information for PEI programs. Again, we're going to be asking all CSS and PEI programs to be reporting on outcomes. So that's why it's important that, I know this feels like it's very PEI focused right now, but that's why it's important that CSS programs are here as well, because we want to go through how we're going to be asking for outcomes and what those could potentially look like for your program. We're also going to be asking all PEI programs to report on referrals. So right now, that's actually only been part of some of the PEI service areas. But as all PEI programs are expected to report on the different PEI strategy areas, this increasing access and linkage to treatment and improving access to services, the outcomes associated with that are actually what types of mental health services folks are being referred to. So that's a change that we're going to be asking all programs to kind of report on that. Which might be facilitated by the Pathways Hub, we hope, but kind of TBD. And then lastly, we worked with Lake to really try and clarify the questions, really clarify what it is that we're asking in each question and provide a lot more examples of what kind of information that might look like for your program. And we know that every program is super different and the type of information you're going to be reporting is super different, but we tried to really give a lot of examples that hopefully your program can kind of relate to. So we also know that collecting this information might be new for some programs. You might not have any outcome data collected yet. You might still be trying to figure that out. So that's okay. What we really want for this year is to kind of help you to come up with a plan of what your data collection is going to be moving forward. So this is really like, and if you already have outcome data for last year, that's amazing. We know some programs have been collecting outcome data and have been reporting on it. That's awesome. But really kind of what we're hoping to get out with this year is to come up with a plan for each program of what you're going to be collecting. Okay, so before we move into kind of the second phase, which is going to be hopefully a little bit more interactive, a little bit more kind of discussion and moving into an evaluation training, since outcome data is going to be such a big part of these updated Google Forms. I just want to say real quick, does anybody have any questions, any burning questions or things that you want to call out before we move into that? So we are going to kick this next bit off with just another kind of little activity. Paulina's gonna walk us through it. So I'm gonna kick it over to her.
All right, so before we dive into our evaluation training, we wanted to also get a sense of how you're all feeling about evaluation. So I know in our check-in activity, we talked about data, but we want to be more high level, more general. So we're going to be creating a word cloud. So if you navigate to the link that Jamie just dropped in the chat, you'll be able to type in words or very short phrases into the text box, and that will create a word cloud. And if you haven't worked with word clouds before, it's I guess you would call it a diagram that looks like a cloud, but it's made of words. And the bigger the words, the more frequently that word was put into the text box. And then alternatively, the smaller the word, the less. So we'll probably give, I think, about 3 to 5 minutes. And then Jamie will share her screen and show us the word cloud so we can kind of talk about it together and see where we're starting. And so, yeah, but is there any questions about this activity or the word cloud in general?
Is it just a single response? Can we enter multiple?
You can enter in multiple. Yeah. And we'll give folks maybe another like 15 seconds or so, and then I will go ahead and share what we've come up with so far. Okay, I'm going to share a different screen. this is, Paulina, do you want to kind of talk through a little bit like what the words we're seeing?
Yes, so we can see that it's still shifting and transforming as people are entering more words, but we can see that improvement has been the most frequently inputted word in this activity, along with progress and tracking. And then the smaller words probably were only inputted about once, but it looks like we have a lot of consensus in a lot of ways. So when people think about evaluation, they think about improvement, improving their programs, tracking, maybe tracking progress is actually together. So tracking progress of how you're doing with your activities, and that you are implementing what you set out to do. And then I also see some people included assessment, benchmarks, baseline. So those are things that you can always compare your progress to. Diagnosis, important, effectiveness. So you can definitely use evaluation to understand or see the effectiveness of a program or maybe a activity or things of that nature. I also see overwhelming, but at the same time, I see someone said love, they love evaluation. I do as well. Performance. So these are all great. And I think this is a great jumping off point as we're going into the evaluation training. So I'll kick it back over to Jamie, and if you have anything else to add.
Thanks. Yeah, I agree. This is like a great jumping off point. I also really appreciate the folks who have said that it's overwhelming and grueling, because we know that and we hear that a lot. And, you know, again, we really want to try and make the evaluation more approachable, you know, and hopefully not too grueling for all of you. Before I move on, does anybody want to share, just kind of like maybe one or two folks just kind of share what they put in? If not, that's also okay. Okay.
I just would like to see a more streamlined approach across like the peer support centers, for example, since there are multiple peer support centers, like in the way that we're tracking data, evaluating data and outcomes. I think that we're unlikely to get accurate reports or information if we're not all utilizing the same system. And I know that that's just kind of how it goes. And I think really we're the only ones that, as far as like peer support centers that aren't part of the county. So we have to use a different system. But I think that's really it's a detriment to showing the outcomes and like the services being provided. If we aren't utilizing the same data collection and reporting or data collection tools, we're not going to show, I don't think, the best outcomes.
Yeah, thanks for that, Kim. And one thing that we do here, wait, let me stop sharing this word cloud, but we'll also save this word cloud and we'll send it out as part of the evaluation or as part of the training if anybody's interested. Yeah, but Kim, I appreciate that. And I think that one thing that we want to do, because even the peer support centers, you know, they're also different in the types of activities that you provide and who you're serving. So I think maybe that's something that we can talk about, probably not today, but if there are areas to streamline, but also areas for, you know, the harbor to be able to show what's really important to the harbor, which might be different from some of the other peer support centers, but it's a point well taken. And I appreciate that, that comment. Okay, so let me go back to the presentation. Okay, so we're just gonna do a little bit of just a few slides of kind of evaluation 101. So, you know, what is evaluation? And a definition that we commonly see is that it's a systematic method to assess the design, implementation, and outcomes of a program, policy, or a system and promote program improvement. So a key point of program evaluation really is program improvement. And that's really at the heart of it, is being able to use information to better serve your clients and kind of continually improve the program. Some things that evaluation is not, it's not research. Research has a different kind of function, usually more experimental design, and is meant to kind of contribute to the literature more broadly. It's also not program audits. I think that evaluation sometimes gets a bad rap, that it's like, you know, it's an audit of your program and we're going to tell you what you're doing right or wrong, which is really not the case. And then sometimes, you know, it's also not necessarily individual assessment. You know, that might be part of evaluation, of understanding changes in an individual and kind of their outcomes, but it's really taken more at a higher level of looking kind of at what the program is achieving and not necessarily at an individual level of folks who might be participating. So why evaluate? And some of this I think also came through in the word cloud, but you know, one of the reasons that we're here today is about like communicating, like there's part of it that's reporting requirements, that is communicating with program funders, policymakers, and the public. But more so than that, it's an opportunity to really tell your program story and kind of document what it is that your program is doing and what it's achieving, to communicate that to the public, but also to communicate that internally and to kind of understand what is working and what isn't working, and really inform that kind of continuous program improvement. So you can always be better serving your community or your population. Being able to actually understand and show program impact and kind of, again, like telling your story and showing what your program can do. But you need to, you know, you can have the outcomes, but to really understand the why of why something is working, you need to be able to kind of evaluate it. Also, supporting funding requests, like if you can show what your program is doing and show your program impact, this can support funding requests for additional funding, as well as potentially for grant applications. So, you know, this can help your program to potentially expand or to be replicated or to get more of what you need. And also there is a piece of it that can be contributing to a broader understanding of what's working. You know, if you're looking to replicate a program in a different setting, or you're looking to expand a program, you know, if you have a particularly effective model, it could be really important to kind of share what elements of this are really helpful to allow other programs to maybe replicate that. Does anyone want to share like ways maybe that you've used evaluation in a way that it has been helpful for you? Okay.
Hi, this is Carrie. I know for us, you know, collecting data really helps us to see like if our groups are working or not. Another way that we've used, you know, data is to make sure like the outreach van has supplies on it that are being requested by the community. And, you know, evaluating changes is always a good thing, you know, to make sure that, you know, like the change in your hours or the change in location worked for the purpose that you were making those changes. So I love data. So and evaluation, you know, really helps you to ensure that your services are what's needed right now. So.
Awesome. Thank you so much for sharing, Carrie.
You're welcome.
Okay. So also just kind of, you know, where to even start with evaluation. So when thinking through evaluation or what you want to evaluate, we find it really helpful to kind of take this evaluation framework of first really thinking about like, what are your program goals? Like really understanding at the base, at the foundation of your program, like what are you trying to achieve? What do you hope is different because of your program? And this might not necessarily be like, you might not actually be evaluating specifically those or using data for those specific program goals, but that kind of helps you understand what you're working toward. It's also really important to kind of understand what you did, how much you did, and how well you did it. And these are kind of the program activities. So it can be easy when you're thinking about evaluation just to jump straight to the outcomes of what did we achieve, what's different. But it's really important to actually be tracking those program activities and understand what you did, like understand those things of what did we do? Did we do it as we intended? Like Carrie just said, if you make a change, you know, what was that change? How much did you do? And did you do it well? You know, you can, if you don't understand that part, you won't be able to understand your program outcomes and why you're achieving the outcomes that you are achieving. Or if you're not achieving the outcomes you had hoped, it's really important to be able to understand what it was that you were doing to maybe understand what went wrong, or what you can improve. And then the last part, I think the thing that people think a lot of when they hear evaluation is these kind of program outcomes of, you know, how do people experience your program? That's also a perfectly acceptable kind of outcome to be thinking about, is what was the consumer experience or your kind of population experience of your program? And then is anybody better off? Like, did you have the intended impacts that you had hoped? On the side here, some folks may have heard the term a theory of change or a logic model. We don't have time to get that into that today, but this kind of evaluation framework that we're showing is almost like a mini kind of logic model or a mini theory of change, where it's just a framework that really helps you kind of think through this process of like, what are my goals? What are the things that we're putting into our program? What are our activities? How are those going to create the impact that we're hoping to see? So we have this link that I can go ahead and put in the chat if you want to look at it later, but it's just kind of it's kind of a different way of asking these types of questions and can help you kind of think through your own program and outcomes that might be relevant. Okay, so we are going to actually break you out into small groups of either 2 or 3. And, you know, I'm not going to be in the group. Paulina's not going to be in the group. It's not going to be facilitated. We really just want you to kind of talk to a partner or talk to another person and just kind of voice what your program goals are. You know, what is it that you are hoping your program achieves? What would be different? Or what benefits or impacts would you expect?
Okay, I'm going to go ahead and open those up now.
Thanks, Patty. Patty, it looks like we have some folks that aren't in a breakout room yet.
Yeah, I noticed that they're assigned. I'm not sure what happened there. I'll move this one. Maybe they just didn't get into the right room. I'm not sure.
Oh, he hasn't joined yet. Matt or Edgar, can you hear us?
Yes, I can hear you.
Okay, so you may have seen, did you have a prompt kind of come up on your computer that says join breakout room?
Yes.
Can you go ahead and click the button that says yes or join breakout room?
Okay.
And it Canocti, I'm not sure if they're fully connected to the meeting. They've been having some audio issues, it looks like.
Yeah, I think they called in.
That's the only one left. I'm not sure what to do about them.
I'm not sure either.
I put the questions in the chat, but I really hope I didn't do it too late. I don't think I did. I think I did it right before the breakout rooms opened, but I'm not a co-host or a host, but do either of you have the ability to send breakout rooms updates or like messages?
Yeah. Patty, would you mind making Paulina a co-host?
Mine says that she is a co-host. That's weird.
Actually, wait, I think I can. I can broadcast a message. Sorry, I
Awesome.
didn't say that. Perfect.
Paulina, I'm entering in right now.
Oh, thank you.
I guess I should pause the recording.
Welcome back.
You're welcome.
That came to you today.
I appreciate that. I totally appreciate it.
Yeah,
Hi, everyone. Welcome back. How did that go? Did the breakout rooms work? Good. Does anybody want to kind of just report back or share either what your partner said or kind of share your own program goals out to the larger group?
Well, next time you put us in breakout groups, can you have like the questions posted in those breakout groups? Because that made it difficult for us to like know what we were like, wait, oh, so are we talking about what we want, how we're gonna do it? I don't think we even spoke about like address these questions because we're like, shoot, and we were gonna message you, but then it was only myself and Carrie in that breakout room. And then we're like, well, I don't know.
So what did you talk about?
Yeah, we talked about like data collection, and the membership form that they use to collect not only like demographics, but also a brief survey, which I like the idea of. And they're switching their system over, and it's just been a nightmare for them.
I mean, our
Okay.
last data system wasn't great either. So if anything, this is an improvement, but when it's a brand new system, it is a whole bunch of learning opportunities. And so the moment we tried to pull a report, we're like, oh my gosh, we have holes here, or why is this pulling it? It's a process.
Yeah. So you all may have answered the second question. So when we send you back to your breakout rooms in a few minutes, you guys can answer these questions on your program goals. And we will, so for sure, for the next one, thank you for bringing that up. I think we put it in the chat, but you may have all dispersed to the breakout rooms before you could get there. So this time we will definitely put, we can broadcast them, but also we'll put the questions in the chat before you go into your breakout rooms. Anyone else want to share? Did anybody talk about their program goals that they want to share? Okay, we can keep moving on. So kind of the next question, when we think back to this evaluation framework, the foundation really is understanding what your program goals are. And then the next kind of set of questions is to help you understand your program activities and then kind of understand your program outcomes. But, how do you even know if you met your program goals? How do you know if your program is doing what was intended or achieving what you were expecting? So this is where evaluation comes in, that you have to actually measure it. So you may have heard the word evaluation measures or evaluation indicators. These are just kind of jargony, lingo-y words for just the things that you're actually going to be collecting data on and measuring to understand if your program is doing what you expected it to be doing and if you're achieving what you hoped it would achieve. So we have some examples, but before we get into them, we just want to kind of talk about like what a good evaluation measure is. So first, it should be specific. It should provide a pretty clear description of something that you want to measure rather than something that's really general or really vague. Like you might want to talk about a specific, if you're talking about activities, you might want to measure you know, and your program goal is around building connection through like peer support groups. You know, you might want to measure the actual number of peer support groups rather than saying we're just going to measure the services we provide. So that's an example of like being specific versus being vague. It also needs to be something that you can actually observe. So this could be an action or a change. So this just means something that like you can actually see what's happening. So you might want to be talking about like if your measure is around changing knowledge of something, rather than saying we want to improve knowledge, it might be we want to see changes in knowledge about specific risk factors, or we want to see changes in knowledge about specific attitudes. It should also be something that you can measure. So this can be something like counts, it can be percentages, it can be averages, it can be changes, but it should be something that you can actually measure. And lastly, they should also be something that actually provide useful information, really kind of always going back to like, what are our program goals? It can be really easy to get daunted by, we're collecting all of this information and we are going to report on all of it. But really kind of going back and thinking like, what is actually like, what are the key kind of things that we're trying to achieve with this program? And what are the key things that can help us understand that, rather than collecting everything under the sun and then being totally overwhelmed by what to use. Similarly, they should be something that's feasible, it's easy to collect, you know, that these don't need to be really kind of complicated evaluations. We really want you to all be thinking about the data that you're already collecting and already using. And then again, kind of being adequate. So this is kind of going back to this, like trying to avoid thinking through 1,000 indicators or 100 indicators, and really maybe thinking about the like 3 to 5 or 3 to 10 that really most align to your program goals. So these are some examples. You know, there's a lot more examples in the forms, but so let's say that your program goal is to create a welcoming environment where community members can connect with peers, strengthen their life skills, and receive basic needs assistance. So if we kind of go through our evaluation framework and think like, okay, well, what did we even do? So some of the program activities might just be like conducting peer activity groups, or maybe there's a weekly pop-up pantry that happens every week and it's a major activity and folks come and they get some food that they need. Or maybe another key activity is providing referrals to community resources. So what are some of the evaluation measures that you could look at to understand if you're actually doing these things? So one could just be, how many peer activities groups did you conduct, and what types of activity groups were there? What was the attendance at these activity groups? Like on average, how many people came to them on a weekly basis? You could count who actually used the pop-up pantry, you know, in a week or a month or a year. And then how many referrals did you provide, and kind of what were the types of referrals that you provided? Some of the outcomes that you might be hoping to achieve to kind of help you get to your program goals might be that participants feel supported by program staff, that they feel welcome. Another outcome could be that you want folks to feel more connected to their peers and to their community, or that participants, through the activities that are provided, that they're able to better meet their basic needs. So some of the things that you could measure for this are, maybe you have just like a survey that you give once a year, or maybe you give it after a group, or maybe once a month. And maybe it's just the number and percentage of individuals who took this survey that agreed on a Likert scale that program staff were helpful, or the number and percentage of individuals who took the survey who felt these peer groups actually helped me feel more connected to my community, or that agreed with a question around, I'm learning skills to better support myself. So, you know, it could be something really basic, like a 3 kind of question survey that you're providing that could help you get some of this information to understand if you're achieving these outcomes. Another example might be a different type of service. So maybe you're not actually a service that's providing kind of one-on-one support. Maybe you're actually a training program, and your goal is to better equip first responders, including primary care providers, teachers, and students, to recognize and respond to the early warning signs of mental illness. So kind of your key activities might be actually doing outreach to let folks even know that this training exists. And then the other key activity is just doing the trainings. So some of the things that you could measure are what were the outreach activities that you did? How many did you do? What types of those did you do? How many trainings did you conduct, and how many people came to those trainings, and what types of folks were they? Some of the outcomes that you might hope to achieve to kind of reach your program goal might be that trainees, after the training, they have a better knowledge about the risk and protective factors of mental illness. And maybe you hope that they have greater confidence in the ability to recognize early warning signs of mental illness. So in this case, maybe you have a pre-post survey, one before the training and one after the training. And the thing that you're measuring is the difference from pre to post in the number of folks who agreed that they know the risk and protective factors for mental illness, and then the change in the number of folks who said that they were confident in their ability to recognize early warning signs of mental illness before and after. So again, really simple type of questions that get exactly at kind of the thing that you're hoping to understand and measure. The types of data sources, we know that this could be a bunch of different things. We just talked about like that there could be questionnaires or surveys. There might be pre-post surveys. You might also just have data from like consumer records. Maybe you have sign-in sheets. Maybe you have a database of the number of folks who are using your program. Maybe you have records of all the outreach contacts that you've provided and some information about them. Maybe you have an electronic health record system that's actually showing all of the services that you provided and to whom. Maybe you have a database or kind of forms about the referrals that you're providing. You might have some other program documentation, maybe some of these programs that are more outreach focused. Maybe you have flyers or posters or those types of things. Like those things can also be data sources. You might have a program that's very clinical in nature. So maybe you actually have clinical assessments. Maybe you've heard of like the CANS or the ANSA, or some of you might use the MORS or different types of clinical tools that are actually helping you understand clinical changes in like mental health symptoms. We've been focusing really a lot on quantitative data since that's probably what most programs capture, but you can also capture information through focus groups with your consumers or with your staff, as well as interviews to kind of understand their experience and how they how they experienced the program and what outcomes that they felt or impacts they felt like they were achieving. Maybe even success stories. So maybe you're hearing success stories through your staff or through program or through the population that you're serving. So these are all different types of data sources. Are there any like different types of data sources that you all are using or have used that aren't on here? And feel free to enter into the chat or call out. Okay, so now we're going to go into another kind of program data pair share. So we will put these questions in the chat. Paulina put them in there. So reference the chat when you go back and you'll go into your same pair shares. But we want to just kind of hear from you all, like what kind of data is your program collecting? What does that data tell you? Like, how have you been using that data? Or if you haven't been using it, what could it tell you? What could it tell you about the program activities that you're doing? What could it tell you about outcomes? What challenges have you been experiencing? So Kim and Carrie, I think you two talked about this a little bit. So again, if you want to talk about your program goals, or you can go into a deeper discussion about this. But we just kind of want you to brainstorm, like thinking about the type of the data that you're collecting or that you could be collecting. And again, if your program isn't collecting or using any data yet, that's okay. Maybe just think with your partner about like what type of data you could be collecting or what kind of data would be useful to you. So again, we're going to put you back into groups for 5 or 6 minutes and just kind of talk for a few minutes, make sure that each of you get a chance to share, and then we'll bring you back and ask a couple of folks to report back out.
Okay, and the groups actually have changed a little bit. We lost a few people, so I had to reorganize. So you might not be in the exact same group you were in before, but I'm going to open them up now.
Thanks, Patty. Give folks a few more seconds to come back.
Hi, Kathleen.
Hello. Is that you, Becky?
It is. I'm trying to figure out how to make my face come on there.
Okay.
But it's good to see you.
Good to hear you.
Yeah.
It cut you off. Oh,
Huh.
Hi, Carrie.
hi, Kathleen.
Hey.
Okay, I think everybody's back. So does anyone want to share maybe like what data your program is collecting and like how you're using that data or how you could use that data?
Well, here at Big Oak, we're like we were talking about in the breakout room, we use sign-in sheets with it's your daily worksheet that you sign in and you basically check off what you're coming in the center for. So that helps us track the services that we're providing as well as the attendance. We do the demographics at least, on everybody once every 6 months, I believe it is. So we get the demographics going too. So we have like a lot of stuff going on today. So it's just a multitude of things. The goal is you leave here in better shape than you walked in, pretty much. So that's how we track. Then we enter that into what's called the WRC tool that tracks this, the attendance basically. Only problem is I think we've had difficulty in extracting the services part in a report from that WRC tool. So if we can change away from that, I'm thinking better as far as the tracking of what individual services we're doing,
Yeah.
Yeah, that is in the works, Davey.
So that's one of the things that we're working on. But that's how we track. We do the sign-in sheets. We also, when we do groups, we do the pre and post surveys. So we put those in, and then we let's see, what else do we do? Well, we have a little form here. It's like a survey that says, how do we do today? And that's for people to fill out if they wish, to let us know how we're doing, so those are some of the things we're doing here.
Awesome. A lot of data collection. And it sounds like, I feel like, Kim, this is kind of what you were saying before too, is like you might have the database, but there's a whole different challenge of getting the data out and getting the reports that you need. And it sounds like maybe you're also experiencing that a little bit as well.
Yeah.
Great.
But they're working on fixing that part, so.
Yeah. Does anyone, so we're going to do a quick or just like a short 5-minute break. Just let people do what you need to do if you have to take a bio break or whatever. But before we do that, does anyone else want to share like the types of data that you're collecting? Not, that's totally okay. Okay, so let's just take a short break and Kathleen, I'm so sorry, you like got here during a activity and now we're breaking. But
Not
yeah.
a problem. I'm actually sharing this with Janine, who was on the first hour from hospice services, and I'm going to pick up the second hour. So yeah,
Great.
thanks.
Okay. Well, let's all come back in 5 minutes at, let's just call it 2:20. So everyone take 6 minutes and just kind of, if there's any emails that you need to get to or take a bio break, and we'll see you in a few minutes.
Thank you.
Thank you, Patty.
Sorry, Amy.
No, you're good. All right, so I'm hoping folks are back. So this will be kind of part 3 of the training. And I know part 2 is probably a little bit fast and that folks might need a little bit more time to kind of think through data and outcomes for your program. And we'll talk about this a little bit more at the end too, but I just want to put in another plug that myself, as well as Patty, are going to be available. Myself and Paulina and Patty are going to be available for technical assistance. So, if after this training, you still feel really confused of like, I don't know what I should be reporting on. I don't know what kind of data I could be using. You know, we are absolutely available for that kind of support. You know, like I said, for one-on-one meetings or just quick emails, you know, kind of whatever you all need. But so with this next part, we are actually going to be walking through. So I'm going to share my screen and walk through kind of the updated templates for the program reporting. So these are the annual Google forms that you fill out. So I'm going to pull those up. This is going to be, so as I mentioned, we have different forms for each program. So that will be similar to the way that you've already been doing it, where Patty kind of will send you a link or will send you your Google form for your specific program. Because each form is different based on which program you actually are. For CSS programs, the forms are actually all the same because the reporting requirements aren't different for CSS programs. But for PEI programs, as we talked about, there's some differences in what programs need to report based on what service area they're in. So what we're going to show is kind of the general PEI form. It's kind of the most standard form. This might not have every single nuance and every single question that your specific program will have to answer, but it's a pretty good indication of what your program will be asked to report on. But just for kind of training purposes, we needed to find the closest we could for like a one size fits all approach. And I'll also kind of note in the form what's different for like CSS programs that you're not required to report on versus PEI. So with that, I'm going to switch screens real quick and pull up this Google form.
To clarify, Jamie, you said for like peer support centers that are integrated, we would still be answering PEI questions as well, correct?
That's right. And actually, so the form that I'm about to pull up is basically what the peer support centers will be reporting on. The peer support centers have the general form. So for, you know, Davey and Edgar and Kim, you know, this will actually be your form.
Awesome, thank you.
Yeah. Okay. And I should also say that we are going to, after we go through this, so I'll spend about 10-15 minutes walking through this form. Then we're going to break out into 2 discussion groups, one led by myself and one led by Paulina. And that will give you time in those slightly smaller, I know we're a small group anyway, but an even smaller group to just kind of ask questions that you might have and kind of what support you have. So this will just kind of be a walkthrough, and then we'll have plenty of time to keep discussing these forms and get your questions down. But so this will just kind of be a quick walkthrough. So this should look familiar. You know, we adapted from the existing Google form that we've already had. We just added in a little bit kind of more information at this beginning part to just kind of clue PI programs in to what, or to all programs to what the sections of the forms are. So CSS programs, you will also have all of these with the exception of the MHSA general standards. You won't have that section because this is just for PI programs, but A through F will be, you'll still have those sections, although the questions in them might be slightly different. We are also asking, and we'll talk about this timeline a little bit later, but for this year, we're also asking programs to kind of have this form completed by the end of this year, just because that gives us a little bit of time in the new year to follow up with programs, see if there's any questions, and make sure that we have all the information that we need to actually get the annual update done. And for this year, so with MHSA annual updates, you're always reporting on the year that's already passed. So for this reporting period, we're going to be asking about information for fiscal year 21-22. So July 1st, 2021 through June 30th, 2022. This first section is technically new, but this is really for our tracking purposes. It's just your MHSA program name. We're asking whoever's actually the person completing the form just to put in their name, their email address, and their phone number. And this is really, like Patty would have this information. This is actually just a little bit more helpful for us to know if we have questions, who we should be reaching back out to. So then we have a program description section. So this should feel pretty similar to kind of what was in the forms before. This first question is really just asking you to provide a brief description of your program, including program goals, target population, the main activities, and kind of where services are provided. So this should be, all of you should have written something like this in the past. It's probably already in last year's annual update or 3-year plan, or you probably already have this language written. We're really encouraging you to take that language that you've used in previous reports, because this information probably isn't really changing. This is really just like a description of what your program is doing and is aimed and like what your goals are. So, but because we changed the language slightly, we're just asking programs to kind of put this back in. Our hope is that for next year, we actually won't need to ask you to rewrite this again. We'll just have your description in here, and it'll be more for you to review and make changes as needed. So hopefully this will be the last year that like you actually have to rewrite this information. But again, we strongly encourage you to like copy and paste this from previous reports, and we'll make sure that those are available to you. So this is where the CSS programs, you're not going to have this question 2. You're going to have a slightly different question 2 that asks you what your underserved populations are and what strategies you use to reach them. For PEI programs, this is where those 3 PEI strategy areas that we were talking about are coming in. And we're asking your program to describe how you're implementing each of these different strategy areas. And again, the first one is how your program increases access and linkage to mental health treatment, like clinical services for folks with identified serious mental illness. We put some examples of like what that might be, or like what we mean by that, of like how are folks going to be identified? How is your program going to refer folks to those services? And if there's going to be any follow-up, you know, to make sure that folks get there, like what would that look like? So we're putting in some prompts to kind of help you understand the type of information we're looking for. The next one is improving timely access to mental health services for underserved population. Again, this is where it's kind of like what underserved populations are you serving? Where are those services provided? How is the way that you're providing services helping to improve access to mental health services for this population? And then lastly, how does your program reduce stigma and discrimination of mental illness? Whether it's around having mental illness, being diagnosed with mental illness, seeking mental health services. So again, this information, like you'll write it this one year, you might have already written some description of this information in previous annual updates or reports. Again, we're strongly encouraging you to like copy and paste that information in. And again, we're hoping this will be the last time that you have to write this and we can just use this information going forward. So the next section is around kind of program activities and referrals. So this is, you know, when we go back to like our evaluation framework and our evaluation questions, this is kind of the section that aligns with that of what your activities actually are. So whereas section B is just kind of a general description of your program and what you're doing and really shouldn't change year to year, section C would change year to year. The first question we're asking is just like, have there been any changes in your program activities? If yes, describe what those are. If no, just write NA. Just say like no changes. Question 4. So this is where we're asking you to actually talk about, you know, what are the types of activities, services, or resources that your program provided in the last fiscal year, and actually provide some data around those. So, you know, if you have data around, so, and again, this should be your key activities. This doesn't need to be every single activity and every single service that you provide. This is really those like key activities that, you know, are really central to the program model. So it might just be a handful of activities. And this is where we're asking for some of that data of, you know, like for your specific program, maybe you're a crisis program. So this might be the number of crisis calls that you responded to. Maybe it's the number of screenings or assessments you completed if you're like an early intervention program. If you're in home visiting program, that maybe this is the number of people that you served and the number of home visits that you had, or the number of phone calls in lieu of home visits. This might be, so for the peer support centers, you know, Davey, you were talking about different things that you provide. This might be the place to talk about the resources that you provided, whether it was like food, clothing, different types of assistance, you know, the shower days, if you provided housing vouchers. If you're an outreach program, this is where you can talk about like maybe the number and type of outreach activities that you provided, attendance at those events. So, and these are just examples. I don't want any program to think that you are responsible for reporting all of these different things. It's just that all of the programs are so different and so varied. So whatever is going to relate to your program is going to be different. But this should really be based, again, on those key activities for your program specific goals. And these are all just here to kind of help you think about what those could be. Not all of these are going to apply to your program. That's totally fine. So this question, this is one of the changes that we're also making this year around whether your program makes referrals to mental health services or substance use services. CSS programs, you're not going to have this question. This is just PEI programs, but every PEI program is going to have this question. So the first question is just like, does your program make referrals? We recognize that not all programs do. It wouldn't make sense for your program model. So just yes or no. And then if your program does make those referrals, we're asking you to just put in the number of folks who are referred to either mental health services or substance use services. And the way that the MHSA breaks it down is whether it's provided by the kind of county services or if it's at another agency. We also know that your program might not already be tracking this information, or you might not have a way to track it. So if that's the case, that's totally fine. We just want you to kind of describe a way that you might be able to track this in the future. I also just want to call out that we know that Lake is in the midst of kind of implementing the Pathways Hub. Ideally, Pathways Hub will take care of this question for programs, but I think right now in the early stages of the Pathways Hub, we just don't know what's possible or what reports or what type of information we're going to be able to get out of that. So that's why we're kind of building in this question here as well. So again, if you already have this information, you have a way to track it, great, put it in. If you don't, that's okay. Just kind of explain, why you can't track that information and maybe how you hope to potentially be able to track it in the future. So the next section is around program outcomes. And so we changed this section quite a bit from the previous years. And we're really hoping that these questions kind of read a little bit more like the way we talked about program outcomes earlier in this training. The first thing that we want you to do, so for PEI programs, you might remember that there was this like really big program outcome section that asked you if your program tried to, or like if your program aimed to reduce hospitalizations or reduce incarcerations, reduce homelessness, all these really long-term indicators that most programs probably aren't achieving in the near term. It might be something that would happen years down the line or that your program isn't really directly impacting. So we really changed the form this year to be about the outcomes that that are aligned to your program goals and that your program is aiming to really directly impact. So for some programs, like for the full service partnerships, reducing psychiatric hospitalizations, incarcerations, homelessness, those are real outcomes that your program would aim to be achieving and that your program might be reporting on. For most programs, that's not going to be the case. It might be things that are more like improving mental health symptoms or improving well-being, improving coping skills, maybe improving knowledge or awareness about mental health or reducing mental health stigma. Maybe your program is really just trying to improve connection and reduce loneliness, or some of these longer term things. So again, there's a bunch of examples here, but what we really want you to do here is kind of think through your evaluation framework, think through your program goals, and just kind of list here, like what is your program trying, what impacts is your program trying to have, and what outcomes does your program aim to directly achieve? So this is another place where hopefully, like if you do it for this year, this information wouldn't really change, assuming that your program goals and what you're trying to achieve with your program doesn't change. The next question, so here's where we put in a ton of examples, and this is where we're asking your program to actually talk about how you're going to measure those outcomes that your program that you listed above. So whatever you list in question 6, we want you to think about how you're going to measure those things. And again, you don't need a ton of outcomes, maybe like 3 to 5, maybe 2 to 5. It's whatever your program is kind of most directly trying to impact. So we put in a ton of examples here. Again, they're not all going to be relevant to your program. There might be things on that your program is aiming to achieve that aren't in this table, but this is really just to kind of like jog your thinking about what this could potentially be. So for example, CSS the outcome that your program might aim to achieve is reducing mental health symptoms and improving functioning. So what's one way that you would know if this is happening? What would you measure to know if your program is achieving the intended result? You might have some clinical assessments. Maybe you have the CANS or the ANSA or the 8 dimensions of wellness, and you're actually looking at the change in assessment scores from enrollment to some follow-up period. Maybe it's 3 months later, 6 months later at program discharge. And you're looking at the number and percent of people who had improved assessment scores. Maybe your program isn't really clinical and the main goal is actually just to improve connection and reduce loneliness. In this case, maybe you have a consumer survey that's administered at the end of the program, and your outcome measure is the number and percentage of individuals who agreed on the survey that participating in this program has helped me feel more connected to my community or peers, or participating in this program has helped me feel less alone. So again, like if your program is aiming to achieve these outcomes, these don't have to be the specific measures. You might have a different survey. You might have different types of questions. These are really just here as examples and things to kind of help you think through what could be possible if you're stuck. So we have this example table, but then we have a blank one that we would want you to fill in with whatever outcomes you identified in the previous question and what those measures and data collection tools are. Then, and again, this question probably wouldn't change, you know, like unless your program goals change or your data collection changes. But again, this is maybe something that we hope that you can fill out this table once and just kind of review it and make changes as necessary for upcoming years. So question 8 would be around what program outcomes did your program actually achieve in the past year? So again, we know that not all programs, you might not be collecting data yet, especially because this is retrospective. This is for the last fiscal year. So you might not have that information yet. That's totally fine. If that's the case, just write that and just say the data are unavailable and what you're going to do in the future to have that information. But for some programs, you might already have this data and you might be ready to report on it. So that's what we would be asking for here. And this is again, based on the set of outcomes that you identified in question 6, and then the outcome measures that you identified in question 7. So using, again, the reduced mental health symptoms, you know, and above, we said that we were going to use a clinical assessment and we were going to look at the change in assessment scores. So this is totally made up, but a potential outcome could be that we had 25 consumers who were in the program and they had assessment data available at program intake and at program discharge. And in this case, we're saying that they're using the MORS, and we're saying that the average MORS score at program intake was 3, and it improved to a score of 4 by 6 months. Or another way to analyze this data might be at 6 months, 50% of consumers showed improved MORS scores compared to a baseline. 30% of consumers' scores didn't change, and 20% had lower scores. So again, we kind of have this example table that you can kind of look through, and then you would fill in this table yourself. And again, if you don't have data yet, that's totally fine. Just underneath, you can just kind of write that we don't have data yet and kind of what your plan is. And all programs, CSS and PEI programs, have the same information. So then this part probably feels familiar. So this is kind of just the program successes and challenges. So some of this might feel redundant, but just like what were your program's key successes during the past fiscal year? Some of these might be related to outcomes, but it might be to something totally different. And if you have any success stories and quotes, feel free to include those. If not, that's fine. If you have any pictures that you want to include, I think that those are always really nice. Feel free to include those. It also doesn't have to be of clients. It can just be of your space. And then question 11 is just what challenges you experienced. So this should all feel pretty similar. We do have some questions around any changes that are anticipated being made for the upcoming fiscal year and how many people you anticipate serving in the upcoming year. We know that this question has been tricky for some folks. If you don't know, or if you're just like, we have no idea, we're like a crisis hotline, we have no idea how many calls we're going to get. you can use the number that you served in the previous year as kind of like a jumping off point, or just put in that number. That's totally fine. Estimates are totally fine. And then lastly, so CSS programs, you don't have this last part. This is the MHSA general standards. Every PEI program has already written this, and we actually just already took what you put in the last annual update and put in here. So what we'll ask you to do is actually just to review it and make any changes. Okay, so I know that was fast, but now we are going to go into breakout rooms for about 10 minutes or so. And we just want to see, you know, like what questions are folks having? What are your feelings? What's kind of like anxieties are you having about this? And like what support might you need? And Paulina and I are both going to facilitate that discussion. So I'll be split in half and joining one of us.
Okay, and if we're ready, I'll go ahead and open those rooms now. Okay.
Yep.
Interview yet for this volunteering. Don't you ask things and stuff like how to do this?
I did,
Oh, you already talked to
but
her.
yeah,
Oh,
I'm gonna see if I got his name right.
Hi, everyone.
you guys.
So we want to just like debrief for a few minutes. I can start with some of the like questions that were coming up in my group that I think will be relevant to probably a lot of folks here. And Paulina, then I'll kind of kick it over to you to like report back. But just so you all know, like we are, like Paulina and I were both taking notes. We're gonna like make an FAQ document to help folks. But first I'll start with, so one thing that came up was around the prevention mini grants, that like this feels really big for a time limited 1-year program, and that like you wouldn't even be having something for what you're going to be doing next year. So we totally know that prevention mini grants, I should have said this, you're not on the hook for all the same types of things. We will still want information around like what your prevention mini grant is doing, what you got the funding for, what you're hoping to achieve with your mini grant, and what you did with it, whether that's like activities or kind of outcomes. Like moving forward, there will be a little bit more of like hopefully some outcome information that we would want you all to be reporting on that is appropriate for your level of program. Like maybe it's a satisfaction survey or something along those lines. We recognize that you're not going to have it for this last year, and there wouldn't be any expectation for you to talk about what your outcome will be for next year, since they will have ended. So we will kind of take another look at those forms, but I feel like there's probably some anxiety from prevention mini grants of like, oh my gosh, this is so much. The other kind of question that we got was around like not having staff to like do the data analysis, or not having the staff to actually like administer the assessments. And so I think that's something that we should talk about more, but we definitely, like our goal really for this year is to kind of just come up with a plan of what type of data you would be collecting in the future, and maybe understand where those pain points are. It's probably going to be different for each program. Like I said, each program is like in a different point, where some programs might not even have outcomes identified, whereas others, you might have your plan and you just can't implement it. And that's also okay. And we just like want you to kind of describe that and kind of the challenges that you're having. And then, you know, maybe there's more that we can do around some of those pain points at a later time. The last one, so this is a question that we will ask, that I think we will take back and ask Scott outside of this, but a few years ago, for folks who have been around for a long time, you may have worked with RDA on logic models. So you may have actually gone through a process for this. And it was a good question. I don't know if those logic models exist somewhere, but we can look on our end, and we'll also just kind of talk with Scott and see if that resource has already been created for some programs, you know, if we can dig it up for you. Paulina, do you want to kind of talk about some of the things that you were hearing?
Mm-hmm. Yeah, my group had a pretty good discussion about how these forms can also be viewed, like you said, as like making a plan for the future. Some people were talking about how like using tools like the clinical tools that we were kind of talking about in the examples, how those aren't really a part of the program evaluation right now, but how they could be in the future. But then how can we also navigate when you're in a program that's very fast paced and how to integrate those types of tools. And so there was some talk of maybe having trainings in the future on those types of tools, or like having the one-on-one TA will also be very helpful. And then let me see, I think that was kind of like our main discussion. We also discussed a little bit about the referrals on the form and how maybe the system now doesn't really differentiate between mental health and SUD, but like finding ways or like going back into records and just trying to figure out that. So yeah, I think that was kind of like the bulk of what we talked about today.
Awesome, thank you. Before I know we only have 5 minutes left, but did anybody have a question that they didn't get to ask, like a burning question? Okay, so let me pull back up. Okay, so sorry, I meant to share this before, but some key timelines. So again, these forms are for last year. We're going to be sending out the individual forms next week. We were going to say Monday, but I realized that's a holiday and Patty might be out on Tuesday. So early next week, each program will be getting kind of your individual forms. And we're requesting that all of these are completed by December 31st. Like I've said a few times throughout this, so we are available for technical assistance. If you have questions, we really want you to reach out to us. We really want to hear questions that you're having. If you're totally stuck on like, what should we be putting in this? Reach out to us, whoever you feel comfortable with. If it's me or Patty or Paulina, like we're all here to help you. But here is my email address. And then you also have Patty's email address. So, you know, if you need help, like if it's just a clarifying question, or if you need help actually like thinking through what potential measures and outcomes could be for your program, like we are here to help you do that. Anina, I'm sorry, I saw that your hand was up. Did I miss you? Did you have a question that you wanted to ask?
No, you answered it, so I'm good.
Great. Love when that happens. Okay, so yeah, really like the technical assistance, we're definitely here to help you all. And we're going to kind of bookend this training with another checkout activity that I'm going to kick over to Paulina.
Yeah, so we're going to end just like we started, and we're going to ask everyone to post an emoji like we did last time, but this time about how you feel about the new reporting forms. So you can type into the chat, or you can have it appear on your screen. Do you feel overwhelmed? Patty feels excited. I know a couple people in my group were talking about feeling a little bit overwhelmed, so that's okay if you also feel that way. Yep, like the so-so feeling.
Ooh, Crystal, what's that?
It's just a smirk. It's like I'm not in between.
I was trying to find that little teeth one that wasn't, you know, that kind of, but I didn't see it in my reaction. So I was just like, well, close, I guess.
Kathleen also posted in the chat kind of like a nervous laugh. That's how I see this one.
Oh, this one. There we go.
I think in some ways I'm relieved, because it does seem very much very similar to what we've reported in the past. There are a few added things for sure, but there's a lot that's familiar as well.
Great. And you know, for the folks who are feeling, you know, like the grr face or the X's on the eyes, you know, like again, if we don't want people feeling that way, so reach out to us if you have questions, if you need some one-on-one time and just need like a little bit more time to talk through with us or with Patty, like that's really what we're here for. And again, like I think the biggest change, like all of this is information that we were kind of asking for before, but especially the outcomes, like we really want it to be relevant and helpful to your program. and not some like pie in the sky thing that like is impossible to collect data on and doesn't make sense and that your program can't even really achieve. So, you know, that's what we're here for, to kind of help you think through those things. So on that note, we really thank you all for being here and for participating in this. We know that this is scary and that this is a lot, but that's kind of what we're here for. And this is the first step. So yeah, thank you for spending 2 hours with us. And like we said, this is being recorded. We will share out the slides. We will share the recording. We will put together an FAQ document, and we'll also kind of share, you know, some of the resources that we talked about, and just try and make this as easy as possible. And just look out for the forms to actually come to you all kind of early next week, either, you know, by Wednesday-ish.
I will be here Tuesday, so I'll send them out as soon as I am on.
Okay, thanks.
Watch
Patty.
for an email from me. You will all get one.
Thank you.